The World Health Organization (WHO) has handed over 8 emergency response vehicles to the Nigerian government as part of efforts to strengthen health security and emergency preparedness across the country. At the handover event, WHO country representative Dr. Walter Kazadi Molumbo said the initiative is part of the Surge flagship project designed to ensure rapid deployment of health response teams within 24 to 48 hours during emergencies. He emphasized that Africa, including Nigeria, face multiple health threats annually, ranging from outbreaks like COVID-19, cholera, Lassa fever, and diphtheria to climate and conflict-induced crises. According to him, this is not just a symbolic gesture. This is not just a symbolic gesture, as the vehicles are practical tools to support logistics, coordination, and community engagement.
It's very important we understand the significance of the Avoc Surge initiative, which, as you heard before, aim to strengthen national and sub-national capacity for emergency preparedness and response. This is in recognition of the fact that, as you know, Africa continues to experience more than 100 health emergencies annually, ranging from disease outbreak and natural disasters to conflict-driven crises. And Nigeria contributes a lot to that, as we all know. And the COVID-19 pandemic, Ebola outbreak, cholera outbreak, Lassa fever, recently, diphtheria outbreak, and even anthrax have tested our system and exposed gaps that need to be urgently addressed. From coordination, to mobility, to workforce readiness, and logistics. And this is why this Avoc Surge flagship project was designed by the regional director in consultation with Africa CDC DG to ensure that countries are able to mobilize within 24 hours of a confirmed emergency. The initiative aims to develop a multidisciplinary, trained, and rapidly deployable national workforce backed by strong operations and logistics at all levels and led by the government.
The Director General of the Nigeria Center for Disease Control and Prevention (NCDC), Dr. Jide Idris, described the gesture as timely, noting that Nigeria is currently managing over 8 public health emergencies.
And the task is enormous. One of the major concerns we have is human resource, especially health security workforce. And this is where the issue of search staff comes in. What I mentioned 3 years ago, I wasn't here 3 years ago. But in the context of what we are doing here, we're talking about search staff. We need search staff at the port health, where people come in. We need search staff who will send people on rapid response teams to various states and local government areas. And these search staff carry out all sorts of things. They do surveillance, they respond, they also train in terms of case management, etc. So there's a lot of work to do. And a major problem is this health security workforce. We need to tackle it together. So this gesture from WHO is highly welcome. What we don't have, they have resources that are supporting us so we can respond appropriately. So I want to thank the WHO for this gesture.
Also speaking, Dr. Adedalapo Fasawe of the FCT Health Services Secretariat highlighted the importance of prevention and surveillance. Preparedness is not about reacting when emergencies strike. It is about building systems, teamwork, and practicing protocols before disaster hits, she said.
Prevention is better than cure. Today, I thank WHO and all partners for making this come true. As much as we talk about emergency preparedness, it is not when emergencies happen that we react. Preparedness includes surveillance, it includes teamwork, it includes group work, it includes being able to activate certain protocols that we have practiced and we have been trained on over the years. I'm very happy that the NCDC is here. I'm happy that the ADC is here. We have worked in partnership. Since the onset of this renewed hope administration, we have been able to quash epidemics. We have been able to work as a team with data and with technology to prevent outbreaks. Today, we are gathered because of the critical role of surveillance and emergency response. As we continue to face emerging and re-emerging health threats, it is imperative that we prioritize robust surveillance systems to
6 states, FCT, Kano, Yobe, Lagos, Abia and Edo, have been selected for the first phase of the surge pilot. It is hoped that this effort will significantly improve Nigeria's emergency readiness at the sub-national level, just as partners reaffirmed their commitment to a resilient, well-coordinated health emergency response system in Nigeria.
Barrister Yelsom Wike and the Minister of State, Dr. Hart, to help in keeping our states healthy, not only in dealing with emergencies, but preventing a situation where an emergency will come up and we will be running helter-skelter. We assure you that these cars will be used for what it is meant for. It will improve our health indices and it will improve our ability to respond like developed nations when we have an outbreak. Thank you very much.
Don't be in front, in the back. You never know.
Step on the brakes.
Able to mobilize resources and ensure the 6 states also have their commissioning like this. So FCT is the first pilot.
Six.
Come back.